Hello, everyone. Happy evening. A very good evening. I hope and I believe all of you are doing well. A quick note whether the audio visual is all good, everyone. Yes, I hope I am audible and visible. If everybody could give a quick nod, that would be great. All right, that's great. So, today in this session, we are going to talk about the top 10 mnemonics. So, basically, there are so many mnemonics that we have discussed throughout the course. And so, we are going to just handpick some mnemonics and we are going to discuss them. This is also for the NEET PG students. And specifically, I've mentioned FMG students because recently we have had FMG exam results. Many students could crack the exam, but there are students who could not as well, unfortunately. So, for them, they need to restart. For the freshers, they need to start. The earlier you start, the better it is, right? So, make the best of the time that you have. And now that the notification was also there recently that there's going to be FMG June 23 exam, right? So that means the June exam is happening and it's better that you start preparing for it right away, because you never know that after that there might not be another FMG exam, there could be a next exam. It being a new exam will lead to unnecessary stress, right? So, and there would be a lot of uncertainties attached to it. So make sure that all the students who are appearing for FMG, who are eligible for the upcoming June 23 FMG exam, you give your best shot. NEET के लिए काम आएंगे ये वाले mnemonics? Definitely. These mnemonics will help for the NEET PG as well. Right. So for all the students who are starting again, who are not very happy with their results, let me tell you this, that nobody can go back and start a new beginning, but anyone can start today and they can make a new ending. Right. So even if you have not got good results, don't worry about it. You can start today and you can give it a very new and a happy ending. Right. So, without any further delay, you should start your preparation for the upcoming FMG exam. And we at Unacademy are there to help you in your journey of cracking the FMG exam. Tomorrow, 7 p.m. On the Unacademy app, that is 10th of February, we have a dedicated special class as well. That's a free live class where I will be talking about the pro tips to crack the FMG exam. You know, what are the mistakes that you should not do? What are the do's and the don'ts? How can you make a plan till the exam? So all the FMG students who are going to appear for the upcoming FMG exam can definitely join in for that session, right? And at Unacademy, the unique features that I personally love about Unacademy is it has live and recorded classes both. So that's a perfect hybrid of your offline live classes and the recorded classes as well. Plus, you have dedicated doubt solving sessions. You also have the iconic subscription. That means you can take Unacademy and Prep Ladder together and you can learn from any device, right? It's not only the phone or the tablet. You can use the laptop, the desktop as well to watch these sessions. And for the FMG students, we are starting with the FMG Mastery course. It is starting tomorrow itself, February 10th. And we have a plan that till April, we will be finishing the theory of all the 19 subjects. And then after that, like last part of April until the June, till the exam, we will do a lot of MCQ practice. That is what exactly you should be doing, mastering the theory and then practicing the MCQs as well. And you can get the 6-month subscription at around 17K. You can use the code Dr. Nikita for additional discount while you are subscribing. For the NEET PG students, we have the final booster batch. It has started on 1st February, a 1-month rapid revision batch. And you can get this batch at around 4.5K. Again, you have the code Dr. Nikita. You will have previous year questions, most expected questions, and the BTR series that will be covered in this batch. Okay, so this is the batch of Vora Shetty that is ongoing for the NEET PG students. If you are looking for the last minute revision, you can have a look at this batch. Okay, so let's start with the discussion now. We will discuss the mnemonics with the help of the MCQs. First one here, tell me what is the drug of choice in OPC poisoning? What's the drug of choice in OPC poisoning? This is a very, very important and a frequently asked question. Yes, it is atropine. How do you remember that is? Remember, OP, that is atropine, is the drug of choice in OPC poisoning. Right? Now, thinking logically, you get to know that atropine is an anticholinergic agent, right? It's an anti-muscarinic agent. So OPC will have what features? What are the features of OPC poisoning? It is going to be cholinomimetic, right? Cholinergic or cholinomimetic properties. So OPCs will have cholinomimetic properties. That means there would be increased secretions. That is what the history would be with OPC poisoning. Also, tell me that with OPC poisoning, how would be the pupil? The pupil would be constricted or the pupil would be dilated. How would be the pupil with OPC poisoning? So cholinergic drugs, COCO, they do pupil constriction. Okay, they do pupil constriction. Remember that cholinergic does constriction. Okay, cholinergic does constriction. Adrenergic, adrenergic, D for dilatation. Adrenergic does dilatation. Right. So this is going to have constricted pupil with increased secretions. So yes, this is also for NEET PG. Again, I'm telling that this is for NEET PG as well. So atropine is the drug of choice in OPC poisoning. Physostigmine, another important question. Physostigmine is the drug of choice in Datura poisoning, right? That's the opposite. Datura or Atropa belladonna poisoning. Anticholinergic, you give a cholinomimetic drug, that is physostigmine. Physostigmine. In myasthenia gravis, the for treatment we use this pyridostigmine. So pyridostigmine helps us get rid of myasthenia gravis. It is used in the treatment of myasthenia gravis, right? So that is the first mnemonic to be learned. Going on to the next one here. Which of these is a nucleotide reverse transcriptase inhibitor? Dr. Happiness, this is for the upcoming FMG exam. This is not for the exam which is already gone. Right. Absolutely correct. Remember, the question is asking about nucleotide, not the nucleoside. The nucleotide reverse transcriptase inhibitor, T for T. Remember, it is tenofovir. Okay, it is tenofovir, which is the nucleotide. Zidovudin, zidovudin comes under NRTI, the nucleoside. एनफ्यूवर्टाइड फ्यूजन पे एक्ट करता है, right? So indinavir is a protease inhibitor. The navirs are the protease inhibitor. So please remember that. So tenofovir is basically for nucleotide reverse transcriptase inhibitor used in HIV. Tenofovir. Okay, very, very important. What is the mechanism of action of raltegravir? What is the mechanism of action of raltegravir? Remember TEGRA, that means it's an integrase, right? It's an integrase inhibitor. Okay, it is an integrase inhibitor drug. So tenofovir is nucleotide. The rest of them are nucleoside or non-nucleoside. Okay. Next one. What do you think is the diagnosis in this case? Absolutely right. This is the Jagger Syndrome. How do I know this is Jagger's? Because of the pigmentation, the melanosis here. It has a melanosis of the skin and the mucous membranes as well, right? So So how do you remember the findings of Peutz-Jaggers? Remember Peutz, P for P, there is pigmentation. Okay, there is pigmentation. There is polyps. Polyps where? Where do we have the polyps? In the large intestine or in the small intestine? What is the most common site? Very correct. Remember JE. Remember the Jaggers is jejunum. Okay, the polyps are in the jejunum. Most common in the small intestine, jejunal polyps. And what appearance do you see? Histopath जब करेंगे, so what appearance do we have? You know the झाड़ जैसा, J for झाड़ जैसा या P for पेड़ जैसा, that is the arborizing pattern. Okay, so what do we see is पेड़ या झाड़ जैसा pattern, that is the arborizing pattern is what we see with Peutz-Jaggers syndrome. So right, remember these are hematomatous polyps. By themselves they are not malignant, but they increase the risk of other malignancies, and the polyps are in the jejunum and there is pigmentation. Okay, and there is pigmentation. Yes, intussusception can occur. The gene is the STK11 gene. Okay, the STK11 gene. So look at this one again. This is very, very important, Peutz-Jaggers syndrome. And what are you seeing in this image here? What are we seeing in this image? So in this image, basically, this is the area which is showing intussusception, right? The target sign or the donut sign, intussusception also can be seen. All right, going on to the next one. Conjoined twins occur when the twin separation occurs during which period? Is it day 2, day 5, day 10 or day 15? Very correct, it is day 15. So the types of twins and the separation period. If it is less than 3 days, if it is 3 to 8 days, if it is 8 to 13 days, or if it is more than 13 days. If the separation occurs less than 3 days, then what kind of twins do we get? It is dichorionic, diamniotic twin. If it is 3 to 8 days, then what kind of twin do we get? Right. Then it is MCDA. Then it is MCMA, monochorionic, monoamniotic. And then we have the conjoined twins. Now, how can you remember this is? So this also tells you about the life principle. You know, the more time you spend with someone, the more difficult the separation becomes. So, right, if you are separated very soon, so you will not have difficulty in having your own independent life, entirely independent life. So, what is the amnion and what is the chorion? Try to understand that concept is the membrane which covers the fetus, first one, that is the amnion, and the outer one, that is the chorion, that's the placenta. So immediate one is the amnion, outer one is the chorion. So imagine that this amnion is like a room in which the fetus is staying, and the chorion is the house in which the fetus is staying. So when the separation is early for the two fetus in the twin pregnancy, so they can have independent lives. That means they can stay in entirely different houses. They can have their entire different houses. That means this is going to be one chorion, two chorion, dichorionic. Of course, the dichorionic has to be diamniotic. If the houses are different, the rooms, of course, would be different, right? So early separation is DCDA. If the fetus, the twins are spending more time, the separation is between 3 to 8 days, they can stay in the same house but independent rooms. That means monochorionic, diamniotic, right? So the closeness is now more. One house but different rooms. If the time duration is still more, they will say that we cannot stay in different rooms. Same house, same room. That is monochorionic, monoamniotic. And if there is still more time that they spend, they cannot stay even in the same room, different beds. It's like all together, right? Even in the same room, that is like conjoined twins. Hamesha saath saath, that is conjoined twins. So remember that the earlier the separation, the more independent the twins would be. That would be dichorionic, diamniotic, right? So remember that सबसे early different house dichorionic diamniotic. फिर उसके बाद one house different rooms, that is monochorionic diamniotic. फिर उसके बाद same house same room, monochorionic monoamniotic, and then we have the last, which is the conjoined twins. Okay, that is the conjoined twins. So conjoined twins will occur latest, that is after day 13, that is day 15. Okay, that is day 15. Is this clear with everyone? Right? And on ultrasound, what sign do you see in these twin pregnancies? Where do you see the lambda sign? Remember, lambda sign के लिए mnemonic is laddu. That is lambda sign is seen in D. D, that is dichorionic diamniotic. Where do you see the T sign? So remember that T sign is Modi G, the most famous T wala in the country. So monochorionic diamniotic, that has the T sign. MCDA is T sign. DCDA is the lambda sign. Okay, it's not MCMA, it is MCDA. Okay, MCDA. Next one. Which of the following is not true about zero order kinetics? We have discussed in the yesterday's Pharmac Plus class as well. Not true about the zero order kinetics. So I see mixed answers here. Correct, Sayanth and Anika. The correct answer here is C. So remember that for zero order kinetics versus first order kinetics. First order kinetics versus zero order kinetics. In the first order kinetics, it is a constant F for F. It's a constant fraction of the drug which is eliminated. In the zero order kinetics, it is the constant, zero is the constant amount of drug which is eliminated. So let's say that in every hour, there is 10 milligram, 10 milligram, 10 milligram of the drug which is eliminated. So it is constant amount. In the first order, it is the fraction which is eliminated of the plasma concentration. So this is dependent on the plasma concentration. This is independent of the plasma concentration, right? So what do we have is a constant amount of drug is excreted per unit time. This is correct for zero order kinetics. The elimination is independent of the plasma concentration. This is also correct, right? The T half and the clearance, they are not constant. Okay, they are not constant, but they don't go in the same direction. If you remember the formula for T half, it is 0.693 into VD upon clearance. So T half and clearance are inversely related. Okay, they are inversely related. So the trick to remember that is which is more at what concentration. Remember T half life is more at H for H, high concentration. Okay, clearance CL, clearance L, clearance is more at low concentration, right? So T half is more at high concentration, but clearance is more at low concentration. Okay, and alcohol is the one which follows pure zero order kinetics. Okay, alcohol is the drug which is pure zero order kinetics. The rest of them are like the pseudo zero order kinetics. They follow zero order at high concentration. Okay, is this clear with everyone about the first order and the zero order kinetics? Going on to the next one, all of the following are ECG changes in hyperkalemia except. Right, absolutely correct. Remember that we do not see U wave in hyperkalemia. The trick to remember is U is UK. So UK is like under kalemia. Okay, under kalemia. So the U wave is seen in under kalemia. That is hypokalemia. Under means hypokalemia. What do we see with hyperkalemia? When the potassium increases, Potassium is the ion which is responsible for repolarization, and repolarization in ECG is indicated by the T wave, right? So when the potassium increases, the T wave increases. So there is going to be tall T waves. When the T wave increases, opposite change in the P wave is what we see. The P wave decreases. There is loss of P wave. And then you have the sine wave pattern, which is seen in severe hyperkalemia. The sine wave pattern is seen in severe hyperkalemia. So remember that U wave is under kalemia. That means it is seen in hypokalemia. So let's have a look at the features. Okay, let's have a look at the features of the hyperkalemia. We have the tall T waves, right? We have the flat P wave. The QRS would be wide, the PR would be prolonged, and there is ST depression. Hypokalemia gives the U wave. Okay, hypokalemia gives the U wave. So let me just zoom in this image. So prominent U wave would be with hypokalemia, right? Is this clear with everyone? U wave has been asked in the recent exam as well. And look at this, the sine wave pattern. The sine wave pattern is seen with severe hyperkalemia when the potassium increases more than 8. And when you have hyperkalemia with ECG changes, what is the first drug that we need to give? The first drug that we need to give is calcium gluconate. Okay, the first drug that we need to give is calcium gluconate, right? So that was about this question here. And look at this ECG. What do you think is this ECG showing? This is the delta wave. Okay, that is WPW syndrome. This is the delta wave of WPW syndrome that we are seeing. Okay. Going on to the next one. What is the neurotransmitter abnormality in Alzheimer's? Neurotransmitter abnormality in Alzheimer's is, right, decreased acetylcholine. Very, very important. Remember, Alzheimer's AL is acetylcholine low. Okay, in Alzheimer's, the acetylcholine is low. That is decreased acetylcholine. That is why in the treatment, the drugs that we use are the ones which increase the acetylcholine. That is acetylcholine esterase inhibitor drugs like donepezil. Okay, like donepezil, rivastigmine, all these drugs which increase the acetylcholine are used. And from where does this acetylcholine come? Which nucleus in the brain secretes this acetylcholine? Remember, A के बाद आता है B. That means acetylcholine is basalis, the nucleus basalis of Maynard. It is the basalis, the nucleus, the basalis nucleus of Maynard. Okay, so acetylcholine is by basalis nucleus of Maynard. Next one here. The diaphragmatic opening for the structure labeled A is present at what vertebral level? What is the structure labeled A here? Everybody is saying T10. Why is it T10? Yes, correct. So look at this image here. Okay, look at this image here. What are we seeing is, this is a CT scan. The white bone, that's the CT scan. This is the contrast CT. These are the kidneys here, right? These are the kidneys that we are seeing here. And this is the aorta. The smaller one on the left side is the aorta, and the larger one on the right side, this is the IVC. Look at the renal vein. The left renal vein is longer. So the left kidney preferred for transplant, right? This is the aorta. What is this structure? In front of the aorta, the left renal vein, that's the superior mesenteric artery, right? So that's why the compression of the left renal vein between the SMA and the aorta, that is called as the nutcracker syndrome. Okay, that's the nutcracker syndrome. So what did we see is this is the IVC here. Okay, we are in the abdomen already at the level of the kidney. So this is not the esophagus. This is IVC. So IVC opening is present at T8 level. The mnemonic that we have is I ate 10 eggs at 12. Right? So I ate, IVC is T8. 10 eggs, 10 is esophagus. T10 is esophagus. At 12, that means aorta is T12, thoracic duct is T12, right? Azygous vein is T12. So aorta, azygous vein, thoracic duct, that is at T12. So I8, that means IVC is at T8 level. 10 eggs, that is esophagus. At 12, that is aorta, azygous vein, and thoracic duct. That is basically the T12 level. Okay, that's the T12 level. Okay, clear with everyone? So diaphragmatic openings are important. Remember that diaphragmatic openings are important. So this is the image showing the mnemonic. I ate 10 eggs at 12. Okay, remember I ate 10 eggs at 12. Next one. What is the X-ray view for inferior orbital fissure? What is the X-ray view for inferior orbital fissure? Correct. Remember, it's the Towne's view. Okay, the Towne's view is for the inferior orbital fissure. Look at this story to remember the various X-ray views related to the paranasal sinuses and the orbit. So imagine that this is a place that you are seeing here. And what do we have is this is a hilly place. The town is located down. Town is down. So remember that down is the inferior orbital fissure. Okay. On the hills are where the houses of the people there. In front of each house, there is a well. Okay. So what do we have is in front of each house, there is a well. So well is located superior on the hill and well is in front. So remember that card well. Well is front, that is frontal sinus, and superior orbital fissure. So inferior is town and superior is well, card well. Next you have is this girl wearing maxi and she is drinking water. So maxi is water, that is water's view is for maxillary sinus. Now when she is drinking water, look at this glass. It is touching the floor of the orbit as well, right? The maxillary sinus as well. So water's view is also for the floor of the orbit. This glass is touching the nose and the chin. So the water's view is also called as the nose chin position. Okay, that's the nose chin position. When she is drinking water, who is staring at her? Through this binoculars, through the foramen of the binoculars, this guy's name is Reese. So remember that Reese sees through the foramen. That means for optic foramen, for optic canal, it is the Reese's view. Okay, that is the Reese's view. So what did we see is Water's view. Water is maxillary sinus and the floor of the orbit. Okay, and the floor of the orbit. Card well. Well is located superior orbital fissure, and in the front, that means it is the superior orbital fissure and the frontal sinus. Town is down, that means the inferior orbital fissure. Reese sees through the foramen, so that is optic foramen or optic canal. Okay, optic foramen or optic canal. Right, so these are the various X-ray views that we should know. And this is how the Towne's view looks like, where you would not see any paranasal sinus basically, right? You would see this foramen magnum in which you would see the dorsum sellae. Okay, the dorsum sella would be seen in the foramen magnum. There is no paranasal sinus that you would see in the Towne's view. Going on to the next one. Which of these is not a component of revised trauma score? So remember that revised trauma score is RTS. That itself is a mnemonic to remember the components of revised trauma score. R stands for respiratory rate. T stands for trauma. What is the score that we do in trauma? It is the Glasgow Coma Scale, the GCS, and S stands for systolic blood pressure. Okay, S stands for systolic blood pressure. So you have respiratory rate, you have GCS, and you have systolic blood pressure. So what is not there? The pulse rate or the heart rate is not there. Diastolic pressure is not there. So remember that in RTS, it is RTS that is included. Another score which has the similar components is the Q SOFA score. Okay, another one is the Q SOFA score which has the same three components. Okay, it has the same three components. Right. In the Q SOFA, remember there is tachypnea. The respiratory rate increases, the systolic blood pressure decreases, the GCS is low. Okay, the same components we see in Q SOFA score. Next one, and I believe this is the last one, the 10th one. SOFA scores, Q SOFA is the quick sequential organ failure assessment. Triple test for diagnosis of Down syndrome includes all of the following except which one? Triple test for diagnosis of Downs includes all of the following except, very good, it is inhibin. So remember that inhibin is inhibited in the triple score. Okay, inhibin is inhibited, it is not allowed. So what is allowed? Beta HCG, estriol. Remember it is estriol. In pregnancy, now the family is becoming the family of three, the mother, father and the child. So it is estriol in pregnancy, not estradiol. And even in that, it is unconjugated estriol. Remember, it is UE3, unconjugated estriol. And we have alpha fetoprotein. Out of this, which increases in Downs? Which of these increases in Downs in the triple test? Out of beta HCG, estriol, AFP, what increases in Downs? Remember that in Downs, high is high. That means HCG and inhibin increase in Downs. It is only beta HCG and inhibin which increase. AFP decreases. Estriol decreases. Only the beta HCG and inhibin increase. Alpha fetoprotein decreases. Remember, alpha fetoprotein decreases. What do you have additional in the quadruple test? Quadruple test additionally has inhibin. Is it inhibin A or is it inhibin B? What is included in the quadruple test? Inhibin A or inhibin B? Remember, it is inhibin A. So A is allowed. Okay, inhibin A is allowed. B is banned. Okay, B is banned. A is allowed. It is inhibin A, which is allowed in the quadruple test, and it increases. What happens? Which is that condition where you see all three decrease in the triple test? Which chromosomal disorder you have all three decrease in the triple test? It is Edwards. Okay, Edwards. Remember Edwards, ED. Everything decreases in Edwards. Okay, everything decreases in Edwards. So all the three markers decrease in Edwards. Okay, Edwards is 18. Basically, Edwards is trisomy 18. Okay, Edwards is trisomy 18. Right. So, yes, these were the top 10 mnemonics for the upcoming FMG exam. Also useful for the NEET PG exam as well. You can make a note of this maybe on a single page and keep them revising for your exam. Right, all of these are important. And a reminder, we have a special class tomorrow at 7 p.m. Where especially for the FMG students, I would be also discussing the pro tips on how do you crack the exam, how do you start, how do you plan the upcoming months. And we would be having the KBMDs for the NEET PG students as well. Stay connected on Telegram group. I would keep you posted when do we have the next session about. Okay. Thank you so much, everyone. And goodbye. Take care. And keep studying, keep revising, and keep winning. Thank you so much.